What should I expect to experience once my testosterone declines due to age? How can I minimize these issues while I am still young? All right, good question. So we have some low T signs here, right? That's what you hear in the commercials. Testosterone starts to decline after the age of 20, 25 in males. So here are some signs that it is declining, and you can actually get this tested. It's a blood test. I don't know how much it costs. You do need to be fasted, and in my opinion, you should take multiple tests because hormones like this vary from day to day sometimes. So, if you get one test and it shows you're low, you might want another test to see if you are actually low, just to kind of confirm your results. So if it was me, I would get multiple tests, and typically you do testosterone testing in the morning because it's at its highest point because it's released when you sleep. So, okay, so here are some signs. One is decreased sex drive, erectile dysfunction, decrease in semen volume. We got hair loss here. Not always the case, but it is a contributing factor, right? Fatigue, if you're feeling more fatigued. Decreases in muscle mass, maybe unexplained. Increases in fat mass because that's just kind of the role testosterone plays. Decreases in bone density, which is not good. Mood changes, so increased rates of depression and so on in lower testosterone moves. Decreases in memory, decreases in testicular size, and increases in anemia, which anemia affects how you produce red blood cells. It is low iron, which may bring us back to that fatigue there. So these are some signs. Of course, you need to get tested before you know you have low testosterone. But more importantly, how do we maintain our testosterone levels? And it's actually basically everything I've already taught us in this class. So number one, exercise. Exercise increases testosterone release, particularly resistance training. That's going to be a huge boost, and particularly compound movements again. So squats, deadlifts, bench press, these movements where we're lifting lots of weight and moving multiple joints at once. Those are going to be really good. HIIT training, high intensity interval training, also increases testosterone. And a ton of low intensity cardio can actually decrease your testosterone. So this is one of the reasons why I like weightlifting for endurance athletes, because it helps boost that testosterone, so they don't have to dope because that's illegal. So, part of resistance training is actually just getting a good hormone release. Okay. And then diet is also important. And you need to have carbs, proteins, and fats. There's lots of evidence showing that if you are eating carbohydrates, it increases your testosterone amount. That doesn't mean obviously go eat a bunch of sugar, but you do need carbs in your diet, protein obviously, and fat. So there's evidence to support all three of these for helping out your testosterone. Next, we have lower stress. So lower stress is going to store more fat mass. More fat mass is going to decrease, more stress can help store fat. More fat can decrease testosterone. So just decreasing stress overall. Vitamin D is actually a supplement that has been shown to boost testosterone levels quite significantly. So you can also get sunlight. We've talked a lot about vitamin D. It's really good for us, obviously. Okay, sleep. Your testosterone primarily is released during your sleep cycles, and this is why you need to get a full solid 8 hours in, especially if you're an athlete, because otherwise, people dope with testosterone to be a better athlete, but then you have athletes sleeping 5 hours a night because I don't know, they don't realize that sleep is like doping, but legal, right? Okay. 6, minimize BPA exposure. So BPA actually has estrogen-like compounds, and so this is some of your plastics and stuff. You'll see, BPA-free water bottles. So try to minimize your exposure there. And then minimize drug use. So alcohol reduces it. Other drugs reduce your testosterone. So there you go. That's a lot of tips to maintain that. Of course, there's always genetic factors on there. But if you're living a healthy lifestyle, doing all these things, you're going to have a much better chance of maintaining your testosterone levels into your old age. And I believe after the age of 50, maybe after the age of 60, I think 2 in 10 men are low in testosterone. So make sure you're doing this stuff so you don't have to go on testosterone, because once you go on testosterone, oftentimes you can't quite get off of that. So, okay, well, that looks like it's pretty good. If you have any more questions, feel free to ask. I will repost this so you guys can watch this, and have a good day.